Okay, learning target 7. Learning target 7 deals with the body's inflammatory response. So, if you've ever had an injury, you probably noticed a few things that happened. Maybe that injury swelled up. Maybe that injury got red. Maybe that injury started to feel a little warm. All of those things are part of this inflammatory response that allows our body, or what our body is doing to try to heal that area and bring the nutrients or the substances that we need to that area to try to heal it. So, what is the inflammatory response? So inflammation says the response that occurs when tissues are damaged. Okay, so really a lot of things can cause inflammation. It could be a sprained ankle. You could get a cut. You could get a burn. Whatever it is, it's going to be a similar response no matter what because we're just trying to heal that area. What does it do? It's mobilizing the body's defenses. Basically, what that means is, your body's trying to defend, stave off infection. It's trying to send things there to try to heal the wound. We're trying to kill things that are causing infection. Remember, Mike. Well, we'll learn about that later in the year with the processes that are going to destroy microorganisms. We're going to break down any cells that have been damaged. So, think of I have a cut. When I have a cut, I damage skin cells. I probably damage some connective tissue cells, epithelial cells. My body's going to try to gobble those up, digest them, and get rid of them. And all that's happening during inflammation. So there's some steps or some 5 things that are going to happen every time with your inflammation. Number one, it's going to get red. That part's pretty easy. You get a cut, you start seeing it get red. Why is it red? Well, it's because I'm sending a bunch of blood there. It's going to get warm. Um, this heat is caused because blood, like I said, is rushing there, and that's carrying heat with it. It starts to swell. Why is it swelling? Again, I keep saying the same thing, but the blood is rushing to it, which causes more fluid in the area. And it's just getting a little bit bigger because we're sending the body's defenses to it. It hurts. Pain is a good thing when this happens. You may not like pain, but the pain is a signal to your body to say, hey, something's wrong. Maybe you should stop using that joint. Maybe you should try to protect that area that's cut. So the pain is a good thing. And then finally, disturbed function. What that means is, and I'll go back to the sprained ankle example. When you sprain your ankle, you can't use your ankle as well. It's got worse function because of the swelling, because of the pain. If you take a step on that ankle, that pain is saying stop using this ankle, and let's cut down on the function so we can heal it. So all 5 of those things happen with the inflammation. Now, with inflammation, we have these things called chemical mediators. Okay, these are things within our body that are sent to the area to help us heal. Okay, they have a lot of fun names: histamine, kinins, prostaglandins, and leukotrienes. Luckily for you guys, we're not going through each individual chemical mediator and each individual function, but just recognize that these are the chemical mediators. They do a bunch of different things. They, excuse me, one is they're going to induce the dilation of blood vessels. Dilation, think of your pupils. If you dilate your pupils, they get bigger. Well, a blood vessel dilates, it gets bigger in size. And when it gets bigger in size, that allows more stuff to rush through that blood vessel. So, like white blood cells, and these other substances that will help fight infection are able to get to that area easier. These things are also causing the redness and the heat because, like I said in the previous slide, tons of blood is rushing to that area. A little more specific about these chemical mediators. Number one, like we said, they induce dilation. So you see, this is constricted, this is dilated, it opened up wider. Oops. Okay, this allows white blood cells and substances to get to that area. Sorry, that's kind of a repeat there. It increases permeability of blood vessels. Let's go back to biology. And you learned about a selectively permeable membrane of the cell. Permeable or permeability just means things can get through it. So um, the when it increases the permeability, it allows things to travel or to exit the blood vessel and into that injured area. So could be proteins, clotting proteins, white blood cells getting to that injured tissue and trying to heal it. And this causes that edema or that swelling. And again, the swelling is what is causing some of that pain and the disturbed function, which we mentioned before. This is kind of what it looks like here. Okay, the capillary got bigger. Capillary is a tiny little blood vessel, right? It's going to release some of that fluid, and you see the permeability. You see things are leaking out of that blood vessel, and that's all a part of this inflammatory response. There's a few other things that we're not really getting into here, like fever and proliferation of white blood cells and stuff like that. But it is, you can see how the dilation and the permeability are happening within the blood vessel. So what happens when I do have this inflammation? Says limitation of movement resulting from edema and tissue destruction all contribute to the disturbed function. So I'm kind of just repeating myself here. Basically, what that means is when you get swelling, you get pain, and you get disturbed function. All of that is just a signal to your body to say this thing needs to heal. If I have a sprained ankle, if I have a swollen elbow, if I have an injury of that nature, all these are signaling my body to shut it down, give that thing time to rest, and let the body do its work. However, sometimes I can trick my body, not really tricking, but um, you can take things like aspirin, which kind of cuts down on the pain. You can get cortisone shots, which is going to relieve some of that inflammation. Antihistamines block the effects of histamines, which is causing some of that swelling and that dilation of the blood vessel. Um, just a brief overview of those things. But again, the inflammatory response, even though you get a thing that's swollen, it's a good thing, and that's the body healing.